Today to talk about the new nerve centre hospital at night and how that will affect the doctors and those working the hospital at night shifts. So, I mean, my plan is to kind of demo the system and how it will work and kind of the views that you will see when you're working the night shifts. But before I do that, I just want to talk a little bit about hospital at night. And if at any point you have a question, I won't be able to see any hands go up. So just stop me, and I'll be happy to answer any questions that you might have about hospital at night. So firstly, hospital at night is a system by the company Nerve Centre. So Nerve Centre is already used on the wards for recording observations, recording some of the notes, and a few other things as well. What Nerve Centre Hospital at night will do is it will replace the majority of the out of hours bleeps for tasks. So it won't replace all of the bleeps. So you will still have bleeps for your Met calls and other emergency calls. But for the majority of tasks, this will now be managed through an electronic system, and the task will be allocated by a clinical coordinator. And the task will then be you'll go to wherever it is you've been requested to go to complete the task, and you would then go into Nerve Centre on a mobile device and mark that task as being completed. So what I'll do is I'm just going to share my screen and demo how the system will work and what you will expect to see once it goes live. So this is the login page for Nerve Centre, and the Nerve Centre application will be available on the mobile devices that are handed out to you at the beginning of your hospital at night shift. As you can see in the top left-hand corner of the screen, you've got the Nerve Centre icon. So you just click onto the Nerve Centre icon, and from here you'll be able to log into Nerve Centre. So your login details will be the same login in which you used to get into the computer or what you used to get into eSearcher, and you should all already have Nerve Centre access. I'm just going to log into Nerve Centre. Once you log into Nerve Centre, you'll be asked your working hours for the shift. The reason for putting in your working hours for the shift is at the end of your shift, what it will do is it will automatically log you out of the system. This prevents either it appearing as you're still logged in online and being assigned tasks when you're no longer working. And it also means that if a device is left out, somebody else can't pick it up and use your login details to complete tasks and record information within the system. So I'm just going to click on 6 hours. And then I'll tap on next, and it will take me through to the next screen. And this is where it will ask for your role. So you can see we've got the various roles available: the hospital at night doctor and the AMU twilight doctor, as well as the junior doctor 5 till 9. So in order to receive tasks for hospital at night, you would need to make sure that your hospital at night doctor setting is toggled. And if you were working on AMU, you would also need to make sure that the AMU option is toggled so that you're able to receive tasks for AMU. Once you've selected your roles for the shift, you would tap on next in the top right hand corner, and it will just ask you what campus you're based at, so what site you're based at. And it's just important to make sure you do put the correct site, otherwise you won't be able to receive tasks for that site. Once you've selected the site, so it's already ticked to Eastbourne as I logged into Eastbourne previously. So I'm just going to stay on Eastbourne, and then I'll click on next. And just to make you aware, before I do go any further, this is just a training system. So any of the patient information in here is not real patient data. Once you've logged into the system, for those of you that have used Nerve Centre previously on the ward, you would just click up in the top left-hand corner and click on patients, and then you're able to go to your patient list and see your list of patients that you're currently looking after. So you can view all of the patient information as you normally would within Nerve Centre. And what I'm going to do now is I'm just going to send a task down to myself so you can see how that task will be received. And the way in which the wards will log tasks is they'll have like an online form on the desktop that they'll just be able to create tasks for. That will then send it through to the clinical coordinator, who will assign the task. So I'm just going to assign a task down to myself. And once you've been assigned a task, you'll see it will pop up on your screen. So the top line will tell you what the task is. Then underneath it, it will tell you the name of the patient, who the task needs to be completed for, their X number and age. Underneath that is going to tell you what ward that patient is on. And then underneath that, you will get the details of the task. As well as the details of the task, you can also see some of the patient information, their date of birth, their gender, what specialty they're currently under, and the coordinator that has assigned you that task. To accept the task, you would click on accept. If you were unable to complete the task or you were too busy, you would click on decline. What that will do is it will send the task back to the coordinator and they'll be able to then assign that task to another member of staff. But for the purpose of this demo, I'm just going to click on accept and I'll show you what happens with that task. So click on accept and you've now accepted that task and it will move into your task pot. To view that task in the top left hand corner, if you click on the menu icon again, you'll see that there is an option for tasks as well. So you would click onto tasks and you will see the current tasks that you have outstanding. So you see it says open tasks. Up the top it says open and close tasks, so you can actually toggle to your previously completed task just by clicking on closed, and it will show any tasks that you've previously worked on and have closed. I'm just going to go back to open. When you're on this page, you can sort the tasks into a particular order. So if you press and hold on any of the tasks, it will allow you to either sort it by priority, by location, or by date. So it will show the oldest task first. What I'm going to do is I'm going to sort them by priority. Doesn't seem to be working. What I'll do is I'll sort them by date then, and what it will do is it will put the oldest task first. You can then click into that task. So if I click into the significant allergic reaction, I'll be able to see the name of the task. Once again, I can see the patient, what ward. I can see that it's been accepted, who it's assigned to, the time it was assigned, and the time at which it was created. And then underneath that, in the field below, I'll be able to see all the task details. So I can see what the task is, but I can also see any additional like notes and information that has been provided through that task. So the news score, whether they've got IV fluid, and a load of other information is available. At this point, if you wanted to, you could add any comments to the task. So you would click onto the add comments line. You can then click into the extra notes field. You'll get a free touch keyboard, and you can type any additional information relating to that task. Once you've done with your task, you would just tap on OK. And you'll see down at the bottom, just above the add comments, it's added that additional note. So it tells you what date the note was added, what time, and what the note information is. Once you have completed the task, you're able to put that you've completed it on the ward or completed it remotely. You would click completed on the ward if you were in person on the ward and you completed it. Reasons for completing it remotely would be maybe if you were given a task to review an X-ray and you were just able to do that remotely via eSearcher and you didn't actually have to go down to the ward, you could communicate them via them with a phone call or messaging them, and you could just put completed remotely once you'd reviewed that X-ray. If you're unable to complete the task, you can click on abort, and when you click onto abort, should give two additional options. So when you click onto abort, it says no time and unable. So you would just choose from the two what abort reason it was. And if you've started the task but it's yet to be incomplete, you would just click started incomplete. and it will keep the task in your task pot, and you can then go back to it and close it once you've done. If you've closed the task in error, in the top right hand corner of the page, you do have the undo button. So you just be able to click onto undo, and it will say undo task action, started incomplete for task, and it will undo the last action that you've done in the task. And that is pretty much how the system will work. So that will be how you receive tasks in Nerve Center, how you then go on to manage the tasks within the system as well. Does anyone have any questions at all about how this works or some of the processes surrounding it? Okay, perfect. I mean, in that case, over the next few weeks, prior to the go live date, so we'll be going live with Hospital at Night on the 6th of October. Over the next few weeks, we will be visiting all of the wards and providing training to the ward staff on how they will submit the requests. We will be providing training to all the doctors on how to use the mobile devices and how to accept and add comments and close the tasks. We will be making sure that the site team, the outreach team are all trained as well on how to use the system, and there will be champions for kind of each team. So there'll be champions for the doctors, champions for the nurses, champions for the site team, and they should be able to assist with any queries out of hours. For the first kind of week or two, myself and the rest of my team will be available on site out of hours in order to kind of make sure that the transition to this system goes well. But if you have any questions for either myself or my team, when we do come down to the wards to show Hospital at Night, please just stop us and ask any questions and we'll be happy to help. Perfect. Well, I mean, if nobody has any questions, that was really all from me. It's just a short demo, just so that you will have an understanding of what is to come in the next few weeks. So thank you very much for coming along today.